Hey, soul survivors. I want to talk about the warning signs and predispositions for breast cancer. You guys have been extremely supportive. It's been 1 week since my biopsy and possible DCIS, and also the things that we need to know pre-diagnoses and also to follow up. So we have some knowledge on this. So thank you guys for your support. Um, I'll be doing several videos, but this one deals with the warning signs per a viewer topic request. So we'll start with that, and then we'll get into the predispositions. Some of them will blow your mind. I'm 6'1", so I have a 10 to 20% increased chance of breast cancer just based on growth hormones and race, all that stuff. We'll get into it. It's pretty interesting. So the warning signs, this is the most common sign is when you have a new lump or in the breast or the underarm. Not all lumps are cancerous, but any new, firm, or irregularly shaped lump should be evaluated. They say it's about 80% of lumps turn out to be benign, but a biopsy is often needed to confirm this. There's differences in breast density, a whole bunch of factors that go into that, but on average, it's about 80% turn out to be benign, and benign are not malignant, not cancerous. So benign is the good one. But the changes in breast shape or size, sudden swelling or shrinkage of the breast unrelated to your menstrual cycle. As women, it's normal to retain some weight, have your breasts swell. I had some bloody nipple discharge. There's differences in the color. Sometimes women will have a milky color, brown, green, clear, and they have different meanings to them. So mine were brown at times, but they can be different colors. So I'll do a different video on that. But the changes in the breast shape, also dimpling or puckering of the skin. Sometimes it's called a peau d'orange, orange peeled skin, and it can indicate inflammatory breast cancer, which is also known as IBC. That's rare, but it is the aggressive type. Also changes in your nipple where it's inverting, which is pulling inward, any scaling, crusting, or sudden changes in color or texture, any nipple discharge, especially if bloody or clear, not the milky kind. Spontaneous discharge from one breast is more concerning than when it's from both. Also, the left side is more prone to cancer. The biopsy I had is right up here. The scar turned out beautiful. I've had 2 biopsies so far. One was like a punch biopsy that was not bad at all. But the needle biopsy uses a 9-gauge needle, and it's not the most comfortable, but I'll do a video on that too. But if you have persistent breast pain or discomfort, while breast cancer is usually painless, some of the aggressive types, like inflammatory breast cancer, they can cause discomfort and tenderness. Also, redness, heat, or swelling. This might indicate an infection, also known as mastitis. But if antibiotics don't resolve it, you might need some further tests. Non-healing sores or ulcers on your breast, particularly concerning are a disease of the breast, Paget's disease. Unique and less known facts about breast cancer. Men can get it too. It's rare for men. It's about 1 in 100 breast cancer cases do occur in men, with a higher mortality rate due to later diagnoses. They're not used to having it on their mind, so they might just brush it off. So 1 in 100 of the breast cancer cases are in men. So dense breast tissue will increase your risk, and they'll have more fibrous glandular tissue as opposed to fat, have up to 4 times the risk of developing cancer, and mammograms may be less effective in detecting abnormalities. So if you're getting a mammogram, if it's super white, the whiter it is, the more dense the breast is. And because it gets so dense, it's harder to see any tumors, microcalcifications, and not all breast cancers form a lump. So inflammatory breast cancer, also known as IBC, accounts for only 1 to 5% of cases but it spreads rapidly and often presents as redness, warmth, and swelling instead of a lump. And breast cancer in young women is more aggressive. So the women that are under 40 and diagnosed often have higher grade tumors, and making regular self-exams and early screenings crucial. The reason I know I have a bloody nipple discharge or some of the different colorings over time is when I was growing up. I'm 54 years old right now, but they were saying to kind of like check your nipples for discharge, and they're telling you not to do that now. So it's more worrisome if it comes out on its own as opposed to expressing it. At this time, they're telling people not to do it because it can cause some trauma to the breast. Sometimes too, that can cause bleeding. So left breast is more common. Studies are showing 5 to 10% increased risk of cancer in the left breast compared to the right, but the reason remains unclear. Sometimes I think it might have something to do with trauma and also the way our seatbelts cross over the left. I know some women who don't drive, either their husbands do or they just have other people driving them. They can still get it on the left. So is it due to the seatbelt? Lifestyle factors matter more than the genetics. So 5 to 10% these cancers are due to the inherited genetic mutations, the BRCA1, BRCA2, but 90 to 95% result from lifestyle or environmental factors. And if you notice any of these signs, definitely don't panic, but also don't ignore them. Early detection does save lives. You can have a clinical breast exam. They'll do some imaging, a mammogram, and if necessary, they might call you back for an ultrasound or MMI, and also the biopsy. And there's different types of biopsies, and it can help determine the next steps. There's regular self-exams, routine screenings, and a healthy lifestyle. Those are your best defenses. But if you guys have any questions or comments, please let me know, because 1 in 8 women can get breast cancer. My mother had it. It was also on her left side. There's different kinds. Some are genetic, some are predispositions just due to different lifestyle changes. So we'll talk about that more, but please leave a comment, hit that notification bell to learn more. And I appreciate all your love and support. I'll keep you up to date on my journey, and I'd love to be there to support you through yours.